Hello people, look at these terminologies. What is concurrent disinfection? Okay, concurrent disinfection. In types of disinfection, you have concurrent disinfection, terminal disinfection, and then one more is there called as PreCurrent or prophylactic disinfection. Okay, so concurrent disinfection means as and when you are going to get the material you're going to disinfect. Okay, that is concurrent disinfection. Like you will disinfect urine, feces, vomit, etc. gloves, aprons, etc. Throughout the course of the illness, you will be disinfecting these soiled articles, right? So that is called as concurrent disinfection. Okay. So as soon as possible, you will do the disinfection. Okay. Coming to terminal disinfection, once the patient leaves, is discharged, you can say after the patient has been removed, right, from that area, then you will disinfect. That is called as terminal disinfection. Okay. But then here the textbook says terminal disinfection is scarcely practiced nowadays. Terminal cleaning is adequate, they are saying. Okay, so they will air along with airing and sunning of rooms. Okay, so they will just make sure that they clean it, air it, and they will give some sunlight so that it will clean. So they're not going to disinfect it as such, fumigation, etc. they're not talking about. Okay, then third one is PreCurrent or prophylactic disinfection, guys. That is disinfection before itself. You'll take before prophylactic, right, to prevent. So here you can talk about hand washing, even pasteurization of milk, chlorination of things before you actually do something, use something. That is called as PreCurrent or prophylactic disinfection. Hope you understood, guys. So what are the three types of disinfection? You have concurrent, terminal, and PreCurrent or prophylactic. Okay, so basically in disinfection, if they ask you in PSM what and all, you will write, you will talk about some history there and some definition as to what a disinfectant is, what is antiseptic is, basically antiseptic is something that you apply on skin, right? Disinfectant is something to apply to a surface or something. And when it comes to disinfection, it is not total, but sterilization is something which will remove all microorganisms, even the spores at all. So sterilization is perfectly the best word, but disinfectant, sterilization, they kind of use these words interchangeably. Anyways, good. Then you have something called as a sterile. Sterile is a good thing, right? Aseptic it will be. Sterile or aseptic. What will be septic? Septic means it is bad, right? It is infected kind of thing. So thus people will have septic shock, correct? Right. Then, properties of an ideal disinfectant. How an ideal disinfectant should be. It should be broad spectrum, fast acting. It should not be affected by environmental factors. It should be non-toxic, guys. It should be compatible. It should leave some residual effect on treated surfaces. Not that when it's there, it works, and when it's not there, it doesn't work. Some amount, like after 2 hours of applying this, it will still maintain the sterility kind of thing. It should be easy to use. The label instructions should be there. It should not have bad smell. It should be economical. It should be soluble. It should be having good cleaning effect also, not just disinfection, and it should be environmental friendly. Okay, so types of disinfection you saw: concurrent, terminal, and PreCurrent. Very good. Now coming to the agents, guys. So agents, you'll have to write all these agents if they ask you. So you have natural agents like sunlight, air. Then you divide things as physical and chemical. Okay, so very important this is. This is very similar to what you have seen in microbiology last year, right? Sterilization, disinfection. So physical means burning, hot air, boiling, right? Autoclave, radiation. So you remember in the microbiology you have already seen. You have seen hot air, right? So hot air oven. What is it? That is dry heat. Whereas you have moist air. That will be autoclave, right? So autoclaving, radiation, all these will be physical. Chemical means what? Because chemicals can be all these chemicals that you will mention. Phenol compounds, quaternary, is it? Quaternary, I thought. That's not right. It is quaternary. Okay. Quaternary ammonia compounds like Savlon, cetrimide, etc. Then you have halogens like chlorine, bleaching powder, sodium hypochlorite, etc. Iodine also you have povidone, iodine tincture, iodophors, right? All that you will write. Alcohol, ethyl alcohol, normal, what you use, spirit. Formaldehyde, formalin, you can write. Oxidizing agents, remember potassium permanganate, hydrogen peroxide, very normal hydrogen peroxide that you use, right? Then para-acetic acid, if you can remember. Oxidizing agents, right? Potassium permanganate, hydrogen peroxide, guys, don't forget. So what are you seeing in chemical? You saw alcohol, halogens, phenol compounds, quaternary ammonium compounds. Okay, then you have metals. Metals, you write silver, zinc, iron, copper, etc. Lime is supposed to be very cheap and all that, so you have to remember this. Okay, lime. ethylene oxide. See, ethylene oxide, it was used in cataract operation, I think, to disinfect the IOL, right? And this could cause some complications, I remember. So this is kind of connected to ophthalmology. Ethylene oxide I have seen. Then miscellaneous, you have pasteurization, microwave, right? Flushing, etc. UV, don't forget UV, ultraviolet, okay? So guys, you remember the same thing in microbiology. You have seen physical methods and chemical methods. Physical methods, you have sun heat, dry heat and moist heat, right? Dry heat is hot air oven, moist heat is the autoclave. Filtration, you have a lot of filters, right? Candle filters, membrane filters. Radiation, you have the gamma rays, X-rays, etc. Non-ionizing radiation will be ultraviolet. Ultraviolet is what we use, right? Non-ionizing one. Ultrasonic vibration also can kill, is it? Okay. Then coming to chemical, you have seen, guys, alcohol. One second. Yes, guys, you have seen alcohol, aldehydes like formaldehyde, phenolic compounds. Just now we saw cresol, phenol compounds, etc. Then you saw halogens, chlorine compounds, oxidizing agents. We already told you, potassium permanganate, hydrogen peroxide. Then they have, talking about some salts, mercuric salts, copper salts. Then quaternary ammonium compounds. Yes. Then dyes, they're talking about gas sterilization. What is this gas sterilization? Here you have the ethylene oxide. See, this is all they can use for fumigation, right, of the OT. So remember all this. Plasma sterilization, ethylene oxide, beta-propiolactone, low temperature steam formaldehyde. See, when it comes to operation theater and all, they're talking about formaldehyde gas, okay? And one more thing you can remember for operation theater is UV light, non-ionizing radiation, okay? Formaldehyde and UV you remember, okay? See, when somebody asks you what is iodophore, no, you hear you say that it is iodine in some other compound, okay? So there will be slow release of iodine. Like example, you have povidone iodine, betadine, okay? If somebody asks you what iodophore is, remember to write this. So there will be iodine in carrier, okay? So there will be slow release of iodine, povidone iodine, okay, betadine. This is also called as what? Betadine, okay. So that is all about the disinfection part in PSM, okay. Bye-bye. Guys, for disinfection, there is one criteria you should know that is called as a Rydell-Walker coefficient, RW. Basically, it measures the effectiveness of the disinfectant, okay. So if RW is more, that Rydell-Walker coefficient is more, that means more is the effectiveness, which is really good, right? That's great. So this is also called as what? Phenolic coefficient. So one is for phenol. Okay. How do you do this? Actually, now it is replaced with Chick-Martin test, they are saying. So this one is an old concept. So let's make it some other color. Say Rydell-Walker coefficient. Chick-Martin test. Yeah. Okay. Thank you. Chick-Martin test. Okay. That is to check whether the disinfectant is effective or not. So look at the some disinfectants you should know. Formalin, right? Formaldehyde, solution of formaldehyde. Bleaching powder, then sodium hypochlorite, ethyl alcohol, spirit, Savlon, that is Cetavlon, Hibitane, Dettol, that is chloroxylenol, povidone iodine, which we told you, is a iodophore, right? Iodophore, right? So that is nothing but iodine in a carrier, so that it will have slow release. Very good. Crude phenol. Pure phenol is not effective. Pure phenol is carbolic acid, isn't it? So crude phenol is phenol plus cresol. So remember this, okay? It's from coal tar. So to phenol, you're adding cresol. Phenol is not effective, okay?